Welcome in. You're listening to Medical Spa Insider, presented by the American Med Spa Association, and we are happy to have you here. This week, AmSpa founder Alex Thiersch catches up with Dr. Stephen Dayan, aesthetics pioneer and medical spa show keynote speaker. Dr. Dayan will discuss his career, his research into the social aspect of beauty, and so much more. And if you want to be social, ratings and reviews are always appreciated.
Okay, everybody, welcome to the program. Alex Thiersch, and this is Medical Spa Insider. And we're very, very pleased to have on the AmSpa hotline a luminary and a very special guest of AmSpa, Dr. Stephen Dayan, who's someone who, many of you probably know, but many of you maybe don't know as well as you should. And I'm really pumped and jazzed to have all of you who don't know Dr. Dayan to introduce you to him. He is going to be doing our keynote at AmSpa conference, aka Medical Spa Show in Vegas, April 9th through 12th at the Wynn. But he is someone who is, number one, is a luminary in aesthetics, a facial plastic surgeon. Impressions Chicago, or Impressions is now the plastic surgery office that he runs in Chicago, and has been really, really influential, not just on aesthetics as a whole, and we'll get into this a little bit, but also on AmSpa in particular. I think, it was around kind of when this whole idea was hatched, was kind of saw it from its beginning stages, and kind of helped cultivate it and saw some of the beginning iterations. So he's got a really unique perspective on where this whole thing has come, and also an incredible speaker, a very passionate mind. He's got so many unique takes on how this goes, how this whole industry goes, and we're very excited to have him at the show in April. Very excited to have him now. Dr. Dayan, how are you? How are things been? It's been a while, but it's great to have you. How have you been?
I'm doing great. A busy day in clinic today and carving out a little time to chat with you. And I always like chatting with you. I don't get to chat with you enough.
I know it's so interesting because it had been a bit since we had connected, and I know you've had a lot going on, and I would love to kind of circle back because we've known each other for a while. I think you were one of the first folks that I met in this entire industry. I think back when I wasn't a baby lawyer, but I was a baby lawyer in this industry. I had kind of started getting myself into aesthetics. Might have been through Terry Wojak or one of those
Also, your
folks.
wife took my college course. Remember
Yes,
that?
that was part of it, is that my wife took, when she was going back to get her degree, took your course and was like, this guy is amazing. It's such an amazing speaker. And I happened to know you very briefly, and then I saw you speak, and somehow I weaseled my way into one of your courses and got you to put me on the stage. And that was back in, I mean, we're talking 2010, maybe something like that, pre-AmSpa even. And how the industry has changed since then. It's been such a crazy ride. I mean, looking back on that time, like I would love to hear your perspective. 15, 16, almost 20 years ago. What does it all mean to you at this point?
Yeah, it's a great segue because so much has changed, right? When I first met you, it was 2010-ish,
Yeah.
and you were a budding lawyer in this space, and we put you on stage, and I was like, wow, you had such incredible information to offer us that we didn't really know about the legal
Yeah.
consequences or ramifications or anything we were doing. I mean, we were just getting started with filler back then, and Botox had come out and it was exciting, but there weren't many people doing it. Plastic
Yeah.
surgeons and dermatologists were kind of like, what? Should we do it? Should we not do it? There certainly weren't aesthetic physicians, at least widely at that time point, and there were very
No.
few practitioners doing it. So
No.
it was very early, very before the med spa industry. And we were all just kind of figuring it out. And it's amazing how we all kind of grew up with this industry together and we really innovated it and took it to where it is today. And it's really had an incredible effect on all of us. It's created a new movement in aesthetic medicine. And now it's so much bigger than anywhere where we could have imagined way back then when we were getting started.
Yeah, it's so true. And the one thing that I remember a bunch from back then, but one of the things that I remember from going to some of the conferences that you put on, first was there was you at I think it was Vegas Cosmetic Surgery, maybe with Dr. Waldman, like had this idea to start really focusing on the business and marketing side of plastic surgery, right? And the aesthetic side. And that was something that at the time was it was obviously it was innovative, but it was also controversial. Like at the time, people in your sphere were like, "Whoa, what are we doing talking about marketing, like and social media and putting yourself out there like that?" Which is baffling to think about right now, right? But at the time, it wasn't. It was there was kind of this divide within your world where folks were not quite ready for physicians to be putting themselves out there like that. Um, and I'm curious, how did you first get into that side of thing? Why did you think at the time, and we're going back to 2008, whatever it is, you always focused on the business and the marketing. Why were you drawn
Well,
to that?
this is a great question, and this is, I think I can make it relevant to people today. I was broke, and there's no greater way
Yep.
to get creative than be broke. When you have nothing, that's the greatest resource to create something special. Everyone always thinks, "Oh, I need money to do this, I need money to do that." Well, the reality is I had no money. I was completely living off the bank, and I was doing something that was very unique at the time. I said, "I'm going to be a cosmetic plastic surgeon. I'm going to do no insurance," and
Yeah.
that was
And that
really
was
kind of
unique.
rogue. At the
Yeah.
time, my professors at the university said, "No, you need to go work with an older doctor. You need to spend time in the emergency rooms and sewing up kids in the middle of the night." I said, "No, I'm going to go out there." And there's this new product out there called Botox. I think it's great. So I started using that. And I couldn't afford putting advertisements in newspapers. But I did. The first month I came out, I had a $3,000 marketing budget. I took $1,500, I put it into the newspaper for an ad, and nobody showed up. And I was so disappointed. I'm like, "Don't you just put an ad and people show up?" No one showed
Mhm.
up. And there was all these older, more experienced doctors. I said, "How am I going to differentiate myself?" And it wasn't going to happen with just an ad in a newspaper. I said, "I need to come up with a more creative idea." And I started getting creative. But truth, I was sitting around doing nothing. I was twiddling my thumbs, trying to get people in the door. I look back on that fondly. At the time, I was nervous. I had a young baby I had to feed. I was at a practice. I was trying to support myself. But you know what? When you're at that level of nervousness is when you get excited and motivated. Nervousness is good. It's really good because that's when you're like, "Okay, I got to work hard." It motivates you. So I came up with a lot of creative ideas on how to get busy, and they started working. And then people started calling me up saying, "Hey, Steve, what are you doing? You're getting busy fast." And I started just giving away my ideas.
Yeah.
One
Yeah.
thing led to another and it turned into a marketing company. And then I started teaching people how to do it, and that turned into the courses you came to. And it wasn't a plan. It wasn't like I'm sitting out there to be a speaker. I'm not sitting out there to create a marketing company or an educational company, but I just was doing it for myself and sharing what I was doing with others. And that's how it kind of all took off. But bottom line is you don't need a lot of money. You need creativity and you need a willingness to work really hard on something. And that is how you get busy.
Yeah, that I mean, I think that's right. Obviously that's right. It's it's also, I mean, and for me, I was doing that as well, but what really landed with me was the, the educational aspect of it was you were taking all of these ideas, not just the ideas, you were taking the people that were helping you create these ideas and put them into place. And you were then creating these tracks for conferences and your own conferences, and they were successful because like you hit the industry at the exact time that folks started thinking, okay, there are going to be more cash pay plastic surgeons, and the med spa started popping up. And so that was what you hit on, and you really created, along with Dr. Waldman and this whole group, like you created this new industry of conferences that focused on the business and marketing side, which had never existed. And in much of what AmSpa is, and the medical spa show is in April, is based upon what you had created. And it's really cool to kind of see the evolution of all that. First of all, I can't wait for you to see the conference, because you're going to be, it's going to resonate with you, but at the same
Yeah.
time it's totally different. Um, it's
Okay, but
it's
I'd
it's
love to
really
hear
cool.
is that you're respecting your history. I think everyone should do that. If you want to know where you're going, know where you came from. And I love that you're recognizing where it started. And I can give you a little bit more color on that because when I gave a talk one time where I was at Randy's conference, it was all plastic surgery conference at that time, Vegas cosmetic surgery.
Mhm.
And I gave a talk, and And all of a sudden, a speaker didn't show up. It's like, do you have anything else you can talk about? I'm like, well, I have this marketing talk. Why don't we try it? So I just put my flash drive in with a marketing talk. I gave the marketing talk, and it was a huge hit.
Mm.
And everyone wanted to ask me a bunch of questions. So the next year, I came back, and Randy's like, why don't we create a room that's dedicated to just marketing? I said, okay. He's like, well, I want you to run it. I'm like, oh, Randy, I don't want to do that. He's like, just run it. So I ran that room, and we had 6 people, 7 people. No one was coming into it. It was kind of like, who wants to go into that room? It was very gauche. It was very
Yeah.
inappropriate.
Yeah.
Oh my gosh, it picked up so fast to the point we had the largest room of the whole meeting. People started bringing their staff. Next thing you know, the surgical rooms were dwindling, and the marketing room that I was running was huge. It became this huge, and I think I brought you to that meeting a couple times.
Yep.
And next thing you know, it's like everyone is interested in that room, and people are coming to the conference just for that room. Then I get a call from the conferences. MCAS in Paris called me, AMWC in Monaco called me and said, "Can you do the same thing here?" Because Europe was a little bit slower to this. So I created
Mhm.
those tracks there also, and it took off there. I personally didn't want to be known as the marketing guy, but I was starting to get that label. So I kind of reeled back from like, listen, I have other things I do too, but I started getting a reputation as the guy who can bring marketing to a conference. And thank God people like yourself figured out how to do it better and created a whole organization around it. And that's the beginnings of AmSpox. I remember you came to me with the idea, and I'm like, oh, Alex, I don't think it's a good idea. You're like, no, I think there's something there. And you were right, and you did it better than we all did it. And look what you
Oh, I
created.
don't know about that, but what I do know is that it was so much about this is also just kind of timing and making sure that you strike while the iron's hot and having the ability to recognize that something is happening. And I think this is what you and Randy also, to his credit, you recognize that something was bubbling, and you got to take advantage of that when it happened. And so the whole idea of marketing for plastic surgeons, that was, again, it's so weird to think of now, but it was a new revolutionary thought. But that allowed everybody else in the practice to come, which opened up this whole new bucket of revenue. And then it sprouted this whole new kind of cottage industry. What I don't think a lot of folks understood, that 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 I think my group happened upon, was the next level providers, like the physicians coming from emergency rooms, from general practice, as well as nurse practitioners. Them coming in, I think that when they came in and didn't really feel comfortable at some of the cosmetic surgeries and the plastic surgery, they needed a place to go. But the first medical spa show and even iterations to now, they are based almost entirely off of VCS and then your conference, mastering the business of aesthetics. Like those are
Yeah.
like the the themes of those, like getting speakers to talk about those types of conferences. I think you had an accountant at one point you brought up there,
Yes.
and I remember seeing them, like, because folks don't know about these things. Obviously, I was a lawyer. You had me up there at some point, and so what I did is we just kind of doubled down on all those things and said, let's get more of those things, more of the business, more of the stuff that people really, that not so much on the clinical. Now, of course, we do a ton of clinical now too, but it is kind of an evolution. But you're right. It all goes back to the same place, which is that you give people what they need, and this is what they need even now. And you're gonna be blown away by what you see, because it really is a different version of what you had helped create in the beginning. So I'm excited for you to see it.
Well, I appreciate that. And, I think we have to always be reinventing ourselves and innovating. And even now, like we're excited about what's happening right today, but what's coming? What's coming in the next
Yeah.
generation? I know I'm giving a keynote speech, and thanks for inviting me for that. And I hope to touch upon that a little bit in the aesthetics arena of like what's coming next. And then how does that help you in your practice? Because I think we've gone a little too far, like we always do, in one direction, and we've kind of lost sight of
Always.
what the aim or the goal is of our everyday practices.
Well, what is coming next? So what do you see for that? Like I mean, you've got a very unique perspective. You've been at this for a while. You also just you've always had a unique perspective when it comes to aesthetics. And I'd love for you to, number one, talk about that a little bit so that people can understand, because you gave these talks on the science of beauty and the science of attraction. That was the one thing that when my wife saw your course, she was just blown away, because it wasn't traditional. It wasn't, you weren't showing before and afters and just basic, surgical results. It was really about like the science of attraction and beauty. And I can't wait for folks to hear you because it's different. Um, what's your approach and what's coming?
So everything is an evolution from there. It started out when I taught at DePaul for many years, and as your wife was in that class on the science of beauty, its impact on culture and business in America. And that kind of got me thinking about why we do what we do, because I can tell you early on, I learned that I can make a patient perfect or close to perfect because there's a mathematical ideal for each person. And that's kind of how I was trained in plastic surgery, is like get these mathematically perfect faces. And then I would treat these patients and they come back in and be like, Dr. Dayan, I'm not so happy. I'm like, but you look great. You're perfect. I
Hmm.
could put your picture in a book. Look, I got your nose perfect or your jawline perfect. Yeah, but I'm not happy. And then conversely, I'd have people, I'm like, oh, your nose is still a little deviated. Dr. Dan, you're the best. I'm so happy. I'm like, okay, as long as you're happy. And I quickly
Hmm.
learned that a lot of what we do is up here, maybe 70% of it or more, not what you see physically. So what is that? And I started diving deep into that.
The Medical Spa Show returns to the Wynn in Las Vegas April 9th through 12th. Every year, MSS is where the best come to get better. Over 100 educational sessions, a sold-out expo hall filled with more than 200 potential brand partners, and networking events that bring together the most supportive community in medical aesthetics. Friends of the pod can save $100 off their registration today with the promo code INSIDER. That's medicalspashow.com, promo code INSIDER. We can't wait to see you there. Promo code expires April 9th, 2026 and only applies to primary registrants. Cannot be combined with any additional offers. Learn more about this event at medicalspashow.com.
And my research took me far and wide with that, and it turned into a college course that I gave at DePaul for many years, which then turned into a New York Times bestseller book called this Subliminally Exposed.
Hmm.
And I have a research company called DeNova, and I still do quite a bit of research looking at what we find attractive and why. And it has such applicability to everything we do, from the products we create to the way we talk to our customers and consumers, to the way we socialize, to the way we date. It's all very relevant. And in today's AI world, it's even more relevant. And that's what I'm going to touch up a little bit about when I speak at your conference, is like where this is evolving and why it's more important today than ever before, is to recognize why we're doing aesthetics. Like, do you really
Hmm.
think about why you do it? Do you do it to make someone look more beautiful, or do you do it to make them feel more beautiful? And do you do it to make their lives better? And I think there should be one unwavering question at the base of everything we do that we should ask our patients. And I think industry should ask this as well, that we don't do in our research, that we don't do when we talk to patients, is is this making your life better? Are my treatments, is your skin product, is your toxin, is your filler, is it making your life better? If is your aesthetics making your life better? And if it's not, then why are you doing it? Why are you
Hmm.
doing it?
Hmm.
But it behooves, when I say that, now what it says to me is, as Dr. Dayan, as your plastic surgeon, I need to prove to you that my treatment is going to make your life better. It's not going to just make you more beautiful. Yeah, that's a byproduct, but I would make your life better. If I'm a skincare line, I can't just tell you I'm going to increase your collagen and elastin levels. I need to make your life better. If I'm a device, I need to make your life better. So when you start to frame the question that way, what you do now is that you do your studies with observer and patient reported outcomes and social metrics. So now I look at my studies, I say, okay, do I increase collagen and elastin? Do I make the face more perfectly proportional? But I also ask, does this person make a better first impression? Does this person feel happier? Do they have, we have these scales now, these tools to validate whether or not they actually feel happier, or do they feel more satisfied in life? And now I think the next step is their social life better? Are they making more money, making more, getting a better job? Whatever is important to them, are they more satisfied in their better relationships? We need to prove that. I think that's where we're going with it. And why I say this is becoming increasingly more important now with AI is very soon, Alex, and maybe not mine in your career, but there'll be a robot sitting next to you.
Hmm.
And how do you know that person's real? Now, they're gonna outsmart us very soon. In the next 3 to 5 years, all AI will outsmart us, but
Yep.
it can't outfeel us. Being
Hmm.
human is the ability to feel and feeling each other. And we get so much value from that. And during COVID, we all recognized that we were lonely, depressed, and anxious, being alone and isolated. We need each other. So where I'm focusing my research now and studies in aesthetics is how our aesthetics influences our social relationship with others.
Yeah.
And
Yeah.
that's where I think we're going. And it's increasingly important with AI to know what's real and what's not.
Yeah. I mean, that's fascinating. And how do you, I mean, I know you'll get into this. I don't want to bury the lead, but like how do you measure things like that, right? I mean, how do you measure the way, an aesthetic treatment makes somebody feel, especially in today's day and age when you're dealing with, body dysmorphia and you're trying to battle all those things too. Like you don't want to overdo somebody. You've got so many treatments and the patient comes in, especially with medical spas, the patient comes in almost sometimes overeducated because they've seen everything there is. They're going to tell you what they want. Um, it's like you're battling on multiple fronts. How do you measure that? It must be tough.
So there are validated tools that we can use to measure whether or not we're getting this outcome. But this is where I think we made a mistake in aesthetic medicine. As we started treating in masses, we started treating people paint by number techniques. This is how you get a better result by putting X amount of filler or X amount of units here. And that's how we taught. And that comes from the companies because they have to teach that way because they're on label.
Right.
But the problem is when you teach that paint by numbers is when you get these overfilled faces. Because in the clinical trials, if I need to prove to you efficacy of a filler or a toxin, I have to overtreat because we're measuring it in a static photo. And to see a wrinkle go away, I have to overfill it in real life. But when that person animates and moves their face, it looks off. It looks weird. Now, humans are really good at detecting when someone's face is off a little bit or unnatural. If the muscles don't work in concert, if they don't work together, that smile looks inauthentic. It looks fake. You think of them less of them. Your impression goes down. But we're training people to put too much in, and the consumer is screaming at us, "Stop! I want to look natural." That's the
Right.
number one question we get and request that we get. But we're not doing it because we're putting too much in. We're not teaching people how to do just a little bit in the right places to get the best results. And there's things that we can do with our fillers and toxins to elevate the corner of the mouth and make someone look happier, change the corner of the eye or the nose. These are things that you don't see. And if you see it, then it fails. So if you see somebody like, oh my gosh, you got a great nose job or a great facelift, it's failed. It doesn't
Mhm.
work because beauty happens at a subconscious level and you need to feel it, not see it. So we need to change the way we teach. We need to teach people how to use the fillers, toxins, and surgery in such a way that you make a slight change, that you alter that person's appearance so they look more healthy, more youthful, more fertile, ultimately is what it comes down to. They look that way.
Mhm.
And then that passes on to the person looking at them and thinks they make a better first impression. We need to teach how to do that. And I think if we do that, we're going to have more patients that are happy. I think that will expand our field.
Yeah. Yeah. And I think that's great because the impression comes from the feeling, not from like looking and saying, "Oh, you had this done, you had this done, you had this done," or I don't see any wrinkles anymore. Like that, it's a feeling, and I think that's yeah, that's
And
so
here's the
this
great
is
thing is it passes on. It's contagious.
yeah,
So if I make you happy, you make your wife happy, which
yeah,
we kind of know, but there's studies now to prove that happiness
yeah,
or satisfaction is 25% contagious. If your neighbors are happy, there's 25% chance you're going to be happier if the people around
yeah,
you are happier. So there's all this research that we just need to glue it on to what we're doing, which is the social psychology. We need to glue it
mhm,
on. And then I'm sure you're going to have more of this in your conference than I see in some of our plastic surgery conferences. But functional medicine, sexual health
mhm.
and wellness, and aesthetics are all coming together right now.
Yep,
And as
they
they
are.
come together, you realize that they're all involved with our patients. So you see the GLPs and the peptides, they're very popular in our practice now. Well, guess what? The GLPs and peptides are doing wonders for people's mood. They're feeling
Hmm.
better about themselves. They're looking better.
Hmm.
Now they're coming into our practices. And their sexual health and wellness is getting better with all the hormones that people are back on. They're improving
Hmm.
libido. When
Hmm.
you feel younger, when you have more sex, you actually feel younger, you feel healthier and you actually may become that way. And all these things are kind of coming together now as our field kind of expands to bring them all into the same fold. We just got to measure what we're doing with the appropriate tools and then teach it
Hmm.
to our young providers and
Hmm.
injectors and physicians.
Yeah, and this is what your keynote address is going to be touching on. It's going to be touching on some of these themes, which I'm very excited to see. Last time I saw one of your talks, I mean, it might have been around the subliminally exposed time, because that book was, it was so good. By the way, I mean, I'm sure folks are probably still buying that to this day, because
They are, but it became a little politically incorrect during the last generation. Now it's back hot again. So
yeah. It's cool though. I mean, it's a cool topic. I do, before we bump up against time, I'm your partner in crime, Dr. Sabrina Fabi, the renowned cosmetic dermatologist, who is a superstar in her own right, and together you guys are like a meteor flashing through the sky. It's amazing. You have a First of all, she's going to be at AmSpa as well. So two for the price of one, and we're excited to have you both there. It's going to be amazing. I'll have to have you both on a podcast when we get there, and
yeah.
try to break the internet. But tell me about the skincare line, because I've seen ads pop up on it. I've gone to the website and looked at it, and it's definitely a slightly different take from other ones that I've seen. But tell me about what that is, and
Yeah.
I think it's going to resonate with our audience in the medical spa. So I'm curious.
I'm glad you asked, and I appreciate it. And we got something special. We got something really, really special. And over my career, I've had so many opportunities to slap my name on a brand of skincare. I've helped many skincare lines. Many of the brands are sitting on my shelves out here. I did the research behind them. So
Yeah.
and so is Sabrina. So we both know the ingredients incredibly well. And I've never wanted to put my name on a skincare brand because, it's like Michael Jordan's got a steakhouse here in Chicago. Do you think Michael Jordan actually makes the steaks? And he doesn't.
Yeah.
If
No.
I'm going to put my name on something, I want to make it. I want to actually, I'm not, most people are like, hi, I'm Dr. So-and-so, here's my famous brand. We didn't do that. If we were going to do something, it had to be intentionally and purposely created and do something different. So I always kind of thought that way. Then Serena and I hunkered down. We isolated during COVID. She got
Mhm.
pregnant. I don't know how that happened, but she got pregnant. Wasn't expected.
Skincare, it happens.
Yeah. And she glowed. She absolutely glowed. And I was like, how do we capture that glow? And anyone who sees a pregnant woman or sees someone in love, that glow of being in love exists. It's real. It's quantifiable and qualifiable. What is it? It's oxytocin. Could
Mhm.
we capture that oxytocin look in a bottle? And we found a way to do it. We don't actually have oxytocin in there, but we found a way to stimulate oxytocin in the skin with a jasmine derivative. So we spent months and months formulating, putting in intentionally clean products to make sure that this was so intentionally clean that it could be available across the world and globally and wouldn't have any problem getting approved. We made sure that it could be at a level that it's not medical per se, but we could use it in our in our
Mhm.
patients. So
Mhm.
we did that. Then we said before we're going to say anything, we got to test it. So we did a
Mhm.
double-blinded placebo randomized controlled trial, and I'm sure you know what that is. Many people
Mhm.
don't know, but to educate people, it is the most rigorous clinical trial you can do. We do that in drug
Yep.
testing. A cosmeceutical doesn't have to do that, and almost no one does that because it's very expensive,
Yep.
and there's a chance you could fail. And then you spent all this time, energy, and effort on something that could fail. But we weren't going to come out with it, and so we did that. We did that and it proved our results were profoundly statistically significant in skin quality. Their skin looked better, not to p-values of 0.05, but p-values of 0.0001, which means highly statistically significant improvement in skin tone evenness, decreased redness, decreased dryness, radiance, dewiness. It was over the top improvement in skin quality because oxytocin is a natural anti-inflammatory antioxidant. So jasmine, we think, was increasing oxytocin levels in the skin. But then I put
Mhm.
in the measures I'm talking about, and these are the measures that I encourage all practices to do, all cosmetics to do now. I encourage all industry to do is looking at the social science of our product. Do people make a better first impression? Statistical significant improvement. They make a better first impression. They're more attractive 3 years younger. Do they find the opposite sex more attractive? Yes. 7 out of 8 men become more attractive after using this product. The more masculine, more dominant his features, the more attractive he becomes.
Mhm.
And then I looked at confidence levels. Confidence went from 60 to 86%. 60% at 4 weeks, 86% after using the product. And then I looked at something that no one's ever done before, sexual satisfaction. I wanted to test
Mhm.
it because I put a pheromone in there. And you know what pheromones are? The chemical messengers
Mhm.
that we elicit when we're
Yeah.
ovulating or fertile. I put that in there and people's sexual satisfaction went up 90% in categories tested. Now, is that because of our product. They felt better about themselves. I can't say for sure, but placebo was 0. I sent it back to the statistician, like, I think you made a mistake. And she's like, no, these results are true. I'm like, oh my gosh. In our clinical trial, the women were breaking the bottles open and scraping the stuff out of the bottom. I thought it was so great. So we created something that's really special. It's unique. It's got science behind it. And then we created our own bottles too.
Yeah.
Next to no. So now we've won so many awards. I think we got 13 awards. So skincare enthusiasts really know about it. Critics know about it. Doctors and practitioners are taking it on. So we're just getting it out there. We're excited about it. I'm not a skincare businessman. So we're just kind of doing it here and there, but it's taking off. And we're approved in Europe now. We're approved in portions of South America. We're approved in Canada. So we'll see where it goes, but we'll talk more about it at AmSpa. But I'm excited to share the science with people and the potential of what this means. It's opening up a whole new category, pro-social medicine. It's about what we do is making you more social. We need to be social. We're not connected anymore. Humans need to connect more, whether it's my Botox, my filler, my surgery, or my skincare.
Yeah, that's awesome. That's awesome. I mean, I want some right now. Let's get everybody when they come into the conference to put some on before they walk in.
XOMDskin.com. So we'll be
XOMD.
there also. I'll have a team there. So anyone who wants to sample it or try it, love to get them on. We're going to offer some specials too. I know the team is working on that at AmSpa. So if people come, they're going to get an opportunity to get a great special.
Yeah, that's awesome.
And then we're also going to do research at your meeting. Like we do before, we're doing a study right now. So if you want to help participate in research with us as we try to figure out first impressions, please come up to our booth and we'll show you.
That's so cool. That's so cool. And it's gonna be cool to have you there. It's gonna be cool to see Sabrina. It's been a bit since I've seen her, and
she's a phenom.
Yeah,
I go around the world with her. People they get catatonic when women see her. There's a line. I mean, we're talking like 3 blocks long. Take photos with her.
Yeah, she is something. She is really. It's and I'm telling you, like it must be kind of odd for you sometimes, because I've seen you in that circumstance too, when folks are lining up to talk to you. It's got to be kind of interesting to have yourself outshone sometimes by her, because she is, and she's an incredible speaker. She's going to be giving a few talks at AmSpa as well. So I can't wait to have you both there. I can't wait for you to see the conference. It's going to be kind of a special moment for us just to have you there. Giving the keynote as well will be cool. So you'll be the keynote is on Friday morning, and you're going to be there pretty much the whole time though. So we'll have to, we'll and you'll be putzing around. We'll have to make sure we get you to the party on Friday night as well, and get you in the VIP booth with the rest of us. And yeah, no, this is cool and exciting. XOMD.com is
XOMDskin.com.
XOMDskin.com. And yeah, I mean, parting words before we go. Otherwise, we'll see you in about 5 weeks.
Excited to be there. Excited for all that you've created. And I'm excited for what the future is holding for aesthetic medicine.
Yeah, me too. And yeah, thanks for all that you've done for the industry and for us as well. It's been cool to watch. So, Dr. Stephen Dayan, thank you so much. And we'll see you in 5 weeks in Vegas.
Look forward to it.
All right.
Thank you to our producer, Madeline Moeller, marketing content coordinator, who organizes the podcast schedule and guests and provides topics and talking points. Audio and video editing, voiceover, graphics, and platform management is provided by myself, Derek Hawk, digital marketing supervisor. Our themes are provided by Maka Music. Thank you for watching or listening to the Medical Spa Insider podcast. Please follow or subscribe wherever you listen to your podcast, and subscribe to our YouTube channel for future episodes. Ratings and reviews are greatly appreciated. For more information about the American Med Spa Association, visit americanmedspa.org. Reference to any specific product or entity does not constitute an endorsement or recommendation by AmSpa. The views expressed by guests are their own, and their appearance in the program does not imply an endorsement of them or any entity that they represent. AmSpa provides this podcast as a full service for educational purposes only. This podcast does not constitute legal advice, nor does it establish an attorney-client relationship. Please consult with an attorney on your legal issues. And as always, thank you for listening to the Medical Spa Insider. Remember, compliance is cool.